62% of adults over the age of 65 wake up in the middle of the night at least 4 times per week. Not occasionally, not during a stressful season, every single week like clockwork. And if you are one of them, I want to ask you something honest. How long have you been telling yourself this is just part of getting older? You fall asleep fine, but somewhere around 2 or 3 in the morning, your eyes open, your mind turns on. You lie there for an hour, maybe two, watching the ceiling. Then you drag through the next day, exhausted, foggy, and irritable. And everyone around you, including your doctor, calls it normal aging. None of that is normal. The 3 a.m. awakening is a warning signal. The brain fog the next afternoon is a warning signal. The feeling that no amount of sleep ever fully restores you, that is a warning signal. And if you keep ignoring it, the downstream consequences move from fatigue to cardiovascular disease to accelerated cognitive decline. This is where we start. My name is Dr. Kalp. I am a board certified sleep medicine physician with 24 years of clinical practice, and I have sat across from thousands of patients, mostly seniors, who were told their sleep problems were untreatable side effects of aging. I have watched that advice devastate people. I am going to tell you what is actually happening in your brain at 3 a.m. and exactly what you can do about it. If your doctor is not having this conversation with you, subscribe to this channel because that is exactly what we do here. The system profits from treating your symptoms. We teach you to eliminate the cause. To understand why you are waking up at 3 a.m., you first need to understand how healthy sleep is actually architected. Sleep is not one continuous state. It is a repeating cycle of four stages: light sleep, two stages of deeper slow wave sleep, and REM sleep, which is where your brain consolidates memory and repairs emotional regulation. Each complete cycle runs roughly 90 minutes, and a healthy adult completes 4 to 6 of these cycles per night. In young adulthood, the majority of your deep slow wave sleep is concentrated in the first half of the night, and your REM sleep dominates the second half, the hours between roughly 3 a.m. and 6 a.m. This architecture is controlled by two intersecting systems: your circadian rhythm, which is your 24-hour biological clock driven by the hormone melatonin, and your sleep pressure system, which accumulates a chemical called adenosine throughout the day and releases it during sleep. When both systems are functioning correctly, they work like a perfectly timed relay, one handing off to the other, keeping you asleep and cycling smoothly from dusk to dawn, right up until it starts to break down. Here is what is actually breaking down. After age 60, the suprachiasmatic nucleus, the master clock in your brain's hypothalamus, begins to lose neurons at a measurable rate. Studies show a 20% reduction in SCN cell density by age 70. This is not a metaphor. You are losing the actual hardware that regulates your body clock. As a result, your circadian rhythm phase advances, meaning it shifts earlier. Your melatonin surge, which normally begins around 9 p.m., begins arriving at 7 or 8 p.m. instead. This means your sleep pressure peaks earlier, your deep sleep stage is compressed into a shorter window, and by 3 a.m., you have completed most of your available deep sleep cycles. The pressure to stay asleep is gone. Your cortisol, the awakening hormone, begins its morning surge earlier than it should, usually by 3 or 4 a.m. rather than 5 or 6. Your body is essentially waking you up on schedule. Its schedule is just 4 hours ahead of where it should be. That is why the 3 a.m. awakening feels biological, because it is. And that is why willpower, relaxation techniques, and herbal teas cannot fix it. You are fighting your own circadian architecture. The root causes feeding this breakdown are not random. Chronic blue light exposure after sunset suppresses melatonin production for up to 3 hours, directly accelerating circadian phase advance in older adults. Physical inactivity reduces the amplitude of your circadian rhythm, meaning the peaks and valleys that anchor your sleep wake cycle become flatter and weaker. Chronic low grade inflammation, which affects 78% of adults over 65 due to a process called inflammaging, directly disrupts both melatonin synthesis and adenosine clearance. Certain medications, including beta blockers, statins, and corticosteroids, are documented to reduce melatonin by 50% or more. And declining sex hormones after menopause or andropause remove a key buffer against nighttime cortisol, leaving the 3 a.m. cortisol surge completely unopposed. This is not cosmetic. This is a structural failure across multiple biological systems. And every night you spend in fragmented sleep, your risk of the next stage of consequences compounds. There is a second system almost no one discusses that is making this dramatically worse. Your glymphatic system, discovered by neuroscientists at the University of Rochester only in 2012, is your brain's waste clearance system. It is active almost exclusively during deep, slow wave sleep, and it works by pulsing cerebrospinal fluid through channels surrounding your brain's blood vessels, flushing out toxic metabolic byproducts, including beta amyloid and tau protein, the exact proteins implicated in Alzheimer's disease. Glymphatic clearance operates at 10 times the rate during sleep compared to wakefulness. When your deep sleep is fragmented, which is exactly what happens when you wake at 3 a.m., your glymphatic system does not get its full operating window. A single night of disrupted sleep increases measurable beta amyloid levels in the cerebrospinal fluid. This is why the connection between sleep disruption in your 60s and cognitive decline in your 70s is not coincidental, it is mechanistic. And here is the detail almost nobody connects. Your glymphatic system is most efficient when you sleep on your side rather than your back, because the drainage angle of the glymphatic channels is optimized by lateral positioning. Your sleep position is a neurological health decision. The complication ladder from here is steep, and it moves faster than most people expect. Fragmented sleep triggers a chronic cortisol elevation pattern, and elevated cortisol suppresses the immune system's natural killer cell activity by up to 30%, meaning you become more vulnerable to infection and cancer surveillance declines. The second rung is cardiovascular. People with chronic sleep fragmentation, defined as 4 or more awakenings per night, have a 2.4 times higher risk of hypertension compared to those sleeping through the night. The mechanism is direct. Each awakening spike activates the sympathetic nervous system, briefly elevating heart rate and blood pressure. 4 spikes per night, 365 nights per year, over a decade, is thousands of unnecessary cardiovascular stress events. The third rung is metabolic. Disrupted slow wave sleep impairs glucose regulation even in people with no diabetes diagnosis. A single week of 3 a.m. awakenings is enough to shift fasting glucose into the pre diabetic range in previously healthy adults. The fourth rung, and this one moves with terrifying speed, is cognitive. Adults over 65 with chronic nighttime awakenings show hippocampal volume loss, measurable brain shrinkage in the memory center, at 3 times the rate of age matched peers with intact sleep. This is not gradual and it is not reversible once it begins. This is why I have zero tolerance for treating nighttime awakenings as trivial. There are two tests you can do right now that tell you whether your circadian system has phase advanced. The first is the dim light melatonin onset test, not a lab test, a behavioral one. For 3 nights in a row, note the time you feel your first genuine wave of sleepiness, not tiredness from sitting still, but the unmistakable pull of actual sleep onset. If that wave consistently arrives before 8:30 p.m., your circadian rhythm has phase advanced by at least 1 to 2 hours. That is your body's clock running ahead of social time, and the 3 a.m. awakening is its direct consequence. The second test is the morning cortisol check. Without an alarm, note what time you wake up spontaneously and whether you feel alert immediately upon waking, not groggy, but genuinely awake and unable to return to sleep within 10 minutes. Immediate full alertness before 5 a.m. is a clinical marker of early phase cortisol surge, which is a measurable, correctable hormonal dysregulation. Normal is waking slowly, needing 10 to 15 minutes to achieve full alertness. Instant alertness at 3 or 4 a.m. is not a sign of good health. It is a sign that your cortisol system has decoupled from your circadian anchor. If either test comes back positive, you need a diagnostic workup. Ask your doctor specifically for a salivary cortisol diurnal curve, 4 samples across the day, and a dim light melatonin onset assay, which measures your actual melatonin timing rather than just a single morning level. Now, let us talk about what you can actually do. There are 3 interventions with strong mechanistic evidence, and none of them require a prescription. The first is morning light anchoring. Within 15 minutes of waking, not after coffee, not after checking your phone, you need to expose your eyes to outdoor bright light for a minimum of 20 minutes. No sunglasses. The mechanism is direct. Morning bright light, ideally above 10,000 lux, which is standard outdoor daylight even on a cloudy day, resets the suprachiasmatic nucleus by activating the retinohypothalamic tract, a dedicated neural pathway from your eyes to your master clock. This suppresses the early melatonin surge that is phase advancing your rhythm and delays its evening onset by an average of 90 minutes over 7 to 14 days of consistent practice. That 90-minute delay is the difference between falling into deep sleep at 9 p.m. and falling into deep sleep at 10:30 p.m. and waking at 3 a.m. versus waking at 4:30 a.m. Do this every single morning, 7 days a week. The circadian clock does not take weekends. The second intervention is phase-timed low-dose melatonin. This is not the 5 or 10 milligram doses sold in every pharmacy. Research from MIT, the institution that first synthesized melatonin pharmacologically, shows that zero point 0.3 milligrams taken 4 to 5 hours before your desired sleep time is as effective as high-dose melatonin at shifting circadian timing, with none of the receptor downregulation that causes high-dose melatonin to stop working within 2 weeks. The mechanism is signal timing, not sedation. You are sending your SCN a time cue, telling it that sunset has arrived. For someone waking at 3 a.m., this means taking zero point 0.3 milligrams at approximately 5 p.m. This is counterintuitive, but it is the pharmacokinetics that matter. You are shifting the melatonin onset window, not inducing sleep at the moment of ingestion. Do this for a minimum of 3 weeks before evaluating effectiveness. Combine it with the morning light protocol for compounding effect. The third intervention is temperature mediated sleep onset consolidation. Core body temperature must drop by 1 to 1.5 degrees Celsius to initiate and maintain deep sleep. And this cooling happens primarily through heat dissipation from your hands and feet via peripheral vasodilation. In older adults, this vasodilation response is blunted, meaning the body cooling needed to sustain deep sleep in the second half of the night does not happen efficiently. The solution is a warm bath or shower, 40 to 42 degrees Celsius, which is hot but comfortable, taken 60 to 90 minutes before your target bedtime. This artificially drives blood to the skin surface, accelerates core cooling when you step out, and has been shown in controlled trials to increase slow wave sleep duration by 34% and reduce nighttime awakenings by 2.1 events per night on average. 15 to 20 minutes, 60 to 90 minutes before bed, every night. No gym membership, no special equipment, no expensive medications. Understand that this condition does not stay in your bedroom. Chronic sleep fragmentation affects your cardiovascular system through repeated sympathetic activation. It affects your brain through accumulated beta amyloid load. It affects your mood through hippocampal volume loss, the same structure that regulates emotional memory. It affects your metabolic health through impaired glucose regulation. And it affects your immune resilience through suppressed natural killer cell activity. Every system in your body is downstream of your sleep architecture. Drop a comment below and tell me your age. I read every one of them, and I use that information directly when I decide what topics to cover next. If you are waking between 2 and 4 a.m., start the morning light protocol tomorrow. If the early alertness test came back positive, ask your doctor for a salivary cortisol diurnal curve and a melatonin timing assay. And if you found this video on your own while your doctor has never once asked you about your sleep fragmentation, then subscribe, because your doctor is not going to bring this up unprompted. There is no billing code for circadian realignment. There is no procedure fee for teaching you the temperature protocol. I tell you the truth because you have every right to have it. Thank you to watching this video.